Hello everyone, welcome to my channel Ravi Static Physio. So in the series of pharmacology, we are moving further and taking another topic which is ne- neuropharmacology. So let's brief about that in introductory part.
And
What is
hypnotic
the
drugs. So let's
neuropharmacology?
get right
A
into it.
scientific study of
The
how
primary use of anxiolytic and hypnotic drugs is to treat
drugs,
anxiety and
both
insomnia.
exogenous and
Anxiety is
endogenous,
generally
affect
defined as an emotional state
cellular and
characterized by
molecular
excessive feelings of
mechanism within
worry,
the nervous
fear, and
system to
nervousness,
alter the
while
neural
insomnia
function,
is generally
behavior,
defined as
and
the
treat
inability to initiate, maintain,
neurological
or
and
achieve restful
psychiatric
sleep.
disorder. So
Now, in order to
basically,
gain better
we are
understanding
a
of how
physiotherapy
anxiolytic and
student,
hypnotic
and why
drugs
we are
work,
studying
first we need to
neuropharmacology
discuss
for
the role of GABA in
understanding
the
the
central nervous
of
system.
composition
So,
of
gamma-aminobutyric acid, or
medicine
GABA
for
for
the
short, is a major inhibitory
if you are doing a
neurotransmitter.
job into the
What that means is
multi-specialty
that when
hospital,
GABA reaches and
so
binds to a
it
specific
treat the
receptor
patient
located
of
on a
any
neuron,
kind of PNF
it
activity
reduces
or
the
any
activity
kind of
level of that neuron and
neuro
makes it less likely to
neuroplasticity
fire
or
its action
performance. So
potential.
make sure the
Now,
indication
GABA
and
is recognized by
contraindication of
both
the action
ligand-gated
of the
and G
drug into the
protein-linked GABA
patient body,
receptors.
and also
In
what
this
you
lecture,
are
we are going to
doing
focus on the
prescribing the
ligand-gated
exercise and
GABA
activity on
receptor
the
called
patient, which will
GABA-A,
be
as this
relevant
is
to
the
each
main
other or
target of
not.
many anxiolytic
So
and hypnotic
sedative
agents.
hypnotics. So based
Now, the
first is
GABA-A
sedative
receptor is
hypnotics.
made up
It
of
is a
5 subunit
central
proteins
nervous
arranged to form a
system
central pore.
depressant
These
that calm
subunits
the
have been labeled with
excitement,
Greek
sedatives,
letters such as
or
alpha,
include
beta,
sleep.
gamma, and delta.
It means
The
a
subunit
patient who
composition
have
of
like
GABA-A
too much
receptors in the
excessive
brain
amount of
most frequently
hypnotic release,
consists
so
of 2
their
alpha subunits,
symptoms to
2
be
beta
like
subunits,
sleep
and 1 gamma or delta
disorder
subunit.
and
Furthermore, for each
not
subunit,
control
many
their mind and
oversubtypes
calm their mind,
exist.
like too much
The
hyperactivity
function of
are
each GABA-A
performing in
receptor
their
depends
body.
on which
So
subunit it
on that
contains.
time there is
For example,
sedative
GABA-A
hypnotics
receptors
drugs
containing alpha-1
prescribing on the
subunit
patient
appear to be involved in
to
sleep, while those that
reduce
contain
their
alpha-2 or
activity
alpha-3
and
appear to be involved in
so
anxiety.
the calmness in their
Now,
body.
when
So
two
there is
GABA
one drug,
molecules bind
major
to the
class of
GABA-A
include
receptor, conformational change is
Benzodiazepines,
induced,
diazepams,
which
and
results in
barbiturates
opening of the
used for
central pore
anxiety and
that allows
insomnia.
negatively
A
charged
patient
chloride
is
ions
suffering
to
from
rush into the cell.
insomnia for
This
like
in turn increases
sleep
the negative
disorder
charge
and
inside the
anxiety
postsynaptic
to
cell,
fear stays or
which
like
makes more
performing any kind
difficult
of
for an excitatory
activity.
input
So
to cause
on
an
that time
action
we are
potential.
prescribing the sedative
Now,
hypnotics like
GABA-A receptors are
benzodiazepines.
present in high
Example of
concentration in the
effect of
limbic
sedatives
system.
includes
In one
relaxed
part of the
feeling,
limbic
decrease
system is the
anxiety,
amygdala,
decrease
which contains
intensity
many
of
neurons that use the
sensation like
neurotransmitter
pain and
GABA to
touch,
control feelings of
drowsiness,
fear and
shallow
anxiety.
breathing, decreased
In
muscle
times of
function,
stress,
and
excitatory neurons in the
interruption in their
amygdala
memory.
fire rapidly,
So, a
sending
patient
excitatory
can
signals
suffer
to
from
other
any
areas
kind
of the
of
brain.
like
It is this type of
high
firing that
breathing,
leads to feelings
high
of panic or
motor
fear.
activity,
The
or like
inhibitory
memory
or inhibitor
loss,
neurons
or
in the
there too much
amygdala regulate
tension,
these
or like
emotions by
anxiety or
releasing
depression.
GABA.
So on that time
The
we are
release of GABA
prescribing
and its
that
binding to postsynaptic receptors
benzodiazepines,
such as
so for
GABA-A
relieve their
inhibits the
pain and
excitatory
decrease
signals
the
that
muscle
result in
activity
feelings of
and
anxiety
reduce
and
the
fear.
like
GABA thus
drowsiness
has a
and
calming,
decrease the muscle
tranquilizing effect on our
hyperactivity.
emotions
So
and
that
prevents
is the
us from becoming overwhelmed in
action.
stressful
Sedative
situations.
can have to dangerous effect, especially
Now, in
in
addition to a
your
distinct binding
misuse
site
them.
for the
It means
neurotransmitter
if
GABA,
you are too
the
much
GABA-A
taking
receptor has
the
also a
sedatives,
site at
because
which
on the
anxiolytic and
patient
hypnotic
you
drugs
have to
bind.
mention that
These drugs can
the
be
patient
divided
have
into
suffering
3
for
groups,
insomnia,
that
like
is,
sleeping disorder, or
benzodiazepines,
regular basis there is
barbiturates,
taking too
and
much sedative
non-benzodiazepine
hypnotics like
hypnotics.
benzodiazepines.
Let's now
So on
discuss
the
these one by
patient
one
there
in
is some
detail,
side
starting with
effects you have to be shown,
benzodiazepines.
like
So,
too much
benzodiazepines
reduce
get
the
their
activity,
name
it
from
will
their
be
chemical
cause
structure,
seizure
which
or
includes a
like
benzene ring
memory
used to
loss,
a
long term
diazepine
exposure.
ring.
So
Their
what is
binding site appears
sedation?
to be the
So
region between
sedation
the
is a
alpha and
state
gamma
of calmness,
subunit of the GABA-A
relaxation, or
receptor.
sleeping, sleepiness
It's
as a
important to
result of
remember that
certain sedative
benzodiazepines do
medication.
not bind to the GABA
Sedation always
recognition site
involves
located at
sedative
the
drugs,
junction of the
but
alpha and beta
not all
subunits.
sedative drugs are
Thereby, they
used
don't
for
induce
full
opening of the
medical
channel as
sedation.
directly
Some
as GABA.
people take
Instead, the binding of
prescribing
a
sedatives for
benzodiazepine to
certain
its
medications
receptor
like
site
insomnia and
increases the
anxiety.
affinity of
So
GABA for
sedation
the
is a
GABA
state
binding site.
where patient have
This
feeling
leads to
unsleep
increased
or
frequency of the
insomnia or
channel
any kind of
opening
stress,
and in turn
or not
increased
going
influx
not
of
for
chloride ions
appropriate
at the
like
postsynaptic
to sleep
cell,
cycle is
which
abnormal
ultimately makes difficult
because
for
of
any
any kind of
excitatory
stress or
inputs to cause
anxiety.
an action
So
potential.
sedation
So when the
sedative
excitatory
drugs are
signals caused by
given on the
fear or
patient,
stress are
so it will be
inhibited in this
so the
way,
state of
the
calmness
result
and
is decreased
relaxation or
anxiety
sleeping
and
feeling on
greater
the
feeling
patient.
of calm.
Make sure sure you
In
have to
addition to
be
that, benzodiazepines can
prescribed.
also produce
It is
mild
not
muscle
a
relaxation as a
counter the
result of their
over
action
the
on
counter
GABA
drug.
receptors
Make
in the
sure you have to
spinal cord,
prescribe of the doctor
cerebellum, and
recommendation. So
brainstem.
label of sedation. minimal
Examples of
help relax, but you
benzodiazepines
will
are
likely to awake.
Alprazolam,
You will be able to answer
4-diazepoxide,
the question, follow up
clonazepam,
direction easily.
diazepam,
So sedation के
lorazepam, and
level,
temazepam.
you have to be later level.
When it
So
comes to side
first is
effects of
minimal. You have
benzodiazepines,
to be
the
like
most
awake,
common ones
and you
are
have to
related to
able
their
to any
sedating and
question.
muscle relaxing
You have to
action.
take any
They
answer
include
of the
drowsiness,
therapist.
dizziness,
Moderate, it makes you
decreased
feel
alertness and
drowsy. You
concentration,
may even
as well
fall
as
asleep.
impairment
You
of motor
may or may
coordination.
not remember part of procedure.
Now, let's move on to the
It
next
means
group,
you
that is
have to be
barbiturates.
able or not
So,
able to take a
barbiturates
answer
bind
or
to GABA A
participate the question
receptor at the
answer
alpha or
of the
beta
doctor or
subunit,
therapist.
which is
Next
different
is to
from
be
the GABA
deep,
binding
make you
site
feel
and also
sleep
different
but
from the
doesn't make you
benzodiazepine binding
lose the
site.
conscious or general anesthesia
Now,
dose.
just like
It means you
benzodiazepines,
have to be
barbiturates
feel
enhance the
full
effect
body
of
sleep,
GABA at the
but
GABA A
the
receptor.
control of the body
However,
in
instead of
yourself,
increasing the
all the
ion
function
channel
of the
opening
body is
frequency,
regulatory is
they
as well,
increase the ion channel
and you
opening
have to be
duration.
conscious
In
of your
other
brain.
words, unlike
Next is to be
benzodiazepines,
what sedative
barbiturates
used
hold the
for.
ion channel
So
open
on which time
continuously
we are
for long
taking the
periods of
sedative
time.
drugs for treating
In
them.
addition to
So
that,
anxiety
barbiturates can
disorder, if the
decrease the
patient has
activity
suffering
of
from any kind of
excitatory
anxiety
neurotransmitters
like fear
such
of
as
stage
acetylcholine
talking
and
and like
glutamate,
doing
and
different
at
kind of
higher
activity
doses,
in
they
primary.
can also mimic
Seizures,
GABA
if there
and
is person
directly
is have
activate GABA
seizures like
receptors,
in their
thus
body,
leading to profound
and
central
also
nervous
the
system
panic
depression.
disorder, there is
This
doing
is
any
why
kind of
barbiturates have a
activity
much
for
lower
the panic
therapeutic
disorder are
index than
coming. You have to be shown any
benzodiazepines,
kind
meaning the
any
toxic
person who
dose
have like
is
panic
not much
disorder to
higher
like
than the therapeutic
too
dose.
much like
The
stress on
examples
the
of
doing any kind of
barbiturates
activity.
include
Sleep disorder like
pentobarbital,
insomnia, there is no
phenobarbital,
calmness and
and
relaxation of the mind
secobarbital.
during the night or
When
sleeping
it comes to
abnormal
side
sleep
effects,
cycle.
barbiturates most
Spasticity
often cause
patient have there is
dizziness,
too much contraction of
lightheadedness,
their muscle and
sedation,
not
as well as
relax them. So
memory
on
and
that time
attention
we are giving the
impairments.
sedative drugs
Furthermore, because
like
of their narrow
benzodiazepine
therapeutic
to
index,
relax
it's
their
important to
body
remember that
of
even
the
small
sedation
barbiturate
by the
overdose
help of
can
sedation.
result in coma
Bipolar
or
disorder,
death
there is
due to
person who have
respiratory
like too
depression.
much two
Now,
activity
let's move on to our last group
two
of
two
drugs, that
activity
is
at the same time. It
non-benzodiazepine
will be
hypnotics.
shown that like
As I
angerness or
mentioned at the
happiness
beginning of this
or
lecture,
like
GABA A receptors in different
sad or
areas of the
emotional or
central nervous
and
system
like happy.
consist of
So
various combinations of the subunits.
repeatedly come in
The
their mind,
specific
and there is
subunit
action
that
is to be
appears to
shown
mediate
continuously. You
sedation
have
is
to be
the
take the
alpha
sedative
1
medication to
isoform.
relieve them
So, as their name
the patient. Next is to be
suggests,
benzodiazepines. So if there is a drugs
non-benzodiazepine
of sedative hypnotics,
hypnotics
so
are
what is the action we have to show and
structurally
when we are use
different
this drug.
from the
So it is depressant drugs that
benzodiazepines,
slow down the
and
massage
as you may
message
already
that
guess, they
travel between your brain and
selectively
your body.
bind to the
It means
alpha 1
if the patient
subunit
have
of
spastic
the
condition
GABA A
and there is too much
receptor,
contraction in their like
thus
biceps,
triggering
so on that
chloride
time the
channel opening
benzodiazepines
with
are helpful for them
resulting
to
membrane
release or relieve their too much
hyperpolarization.
contraction of their biceps or any kind of muscle to
Because
relieve them.
alpha 1
So healthcare
containing
provider
GABA A
minimal prescribe them for
receptors
anxiety
are
disorder or
highly
insomnia and
expressed
seizure.
in wake
So the healthcare
promoting
provider or like
regions of the
doctor will
brain.
be prescribe them
The
the condition of the
preferential
insomnia or
binding of
anxiety or the seizure
non
of the patient
benzodiazepine
with drug is
hypnotics
benzodiazepine.
to
So in
these
benzodiazepine there is
receptors
example of them is
results in
Alprazolam and
sleepiness
Flurazepam. There
but
is two
not anti-anxiety.
classification of the benzodiazepines. So these medication are giving on the insomnia disorder
Examples
and
of
anxiety of seizure. Next is to
non-benzodiazepine
be
hypnotics are
barbiturates. So first is
zolpidem,
benzodiazepine, second is barbiturates.
xalapone,
Both are the sedative
and
hypnotic drug in
azopiclone.
classification. So it cause you to
When
relax, you
it
feel
comes to
drowsy.
side
They can
effects,
also stop to prevent seizure.
non-benzodiazepine
Like both
hypnotics
action are
can
same,
cause
but the
cognitive
condition are like
impairments,
condition are
including
different for
memory
like
loss,
taking the medicine. Like
daytime
if you have like
sedation,
problem of
as
insomnia,
well
so
as
you can take
impairment
the
of motor
benzodiazepines as a
function.
doctor prescription but in barbiturates you
And
have
with
to like
that,
take
I wanted to thank you for
specifically in seizure,
watching. I
and
hope you
also
enjoyed
the
this
stop the
video.
drowsy feeling into the
And as
daytime.
always,
So there is a two
stay
example of
tuned for
barbiturates are
more.
methylohexyl and pentobarbital. The two drugs are there. Like benzodiazepines are work by enhancing a very important neurotransmitter called GABA and gamma-aminobutyric acid at the GABA A receptor. So benzodiazepines are working mechanism is that so it will be bind to the GABA and help to send the signal from one neuron to other neuron, like primary motor neuron to secondary motor neuron, or presynaptic neuron to postsynaptic neuron via neuron junction with the help of neurotransmitter or GABA A receptors to relieve their brain and their functional spasticity action. This result in sedative, hypnotic, sleep inducing, anxiolytic, anti-anxiety, anti-convulsant, like too much hallucination are come in their brain and not control over there, and muscle relaxation properties. So benzodiazepines are most prescribed by doctor for using for treating those patients who have like too much hip insomnia, there is sleeping problem, and anxiolytic, it means anxiety related problem to decrease the anxiety. Anticonvulsant, there is a therapy of passes the current into the brain to relax them brain activity, and muscle relaxation of the too much contraction and spasticity of the person, so it will be relax them. So that is the first topic, like sedative notice of neuropharmacology. Thank you.